welcome back. This morning we're joined by Dr. Ben Emery from Aspen Ridge Dental. Thanks for coming in this morning.
Thanks for having me.
All right, so a lot of the holidays that are bad for your teeth, the Christmas and everything are behind us, but we do have the Super Bowl coming up, so definitely some time for people to be thinking about what they're putting in their mouths. And today we're talking cavities, a very important topic, and you brought some pictures along with you, and we'll take a look at those in a second. But what's maybe one of the things that people most don't understand about cavities?
Well, the thing that people most don't understand is the fact that once you start to develop a cavity in your tooth, it progressively gets worse. There's no reversal on a cavity. As soon as it gets past the enamel into the dentin where the soft tooth structure is, it continues to get larger and larger and larger. The goal is to catch it while it's small in order to do a filling instead of waiting until it's too late where you need a root canal treatment or an extraction. That's what we want to avoid. So I brought some pictures for demonstration purposes.
Take a look at some of these.
For our viewers to take a look at when you go to the dentist, our viewers will be able to understand what the dentist is talking about when they refer to a cavity. Now what I want to show you is a tooth here, this dark line that comes across the back side of this tooth in between the two teeth. That's actually interproximal, so that's where flossing is key.
Okay.
It's a key component, so this is a flossing cavity. So toothbrush bristles cannot get here, so that's why it's very important to floss, to remove the food and the carbohydrates that the bacteria metabolize and secrete byproducts, which can get into the tooth and create decay. On this tooth, you can see that the cavity is a lot larger, and so it approaches the inside of the tooth, which is the nerve canal. Once that cavity reaches the nerve canal, your options are either an extraction or a root canal, depending on if you want to keep the tooth. Now, you always have options of what you can do. There are always things that you can do. So you want to make sure that you talk to your dentist to ask what my options are. Now, if we don't catch the cavity soon enough, we get to an area where this dark area here is a lot larger, or even in this instance where it is entirely gone, the entire tooth structure is gone because the cavity is so profound. In this particular case, the tooth has to be extracted. That is the only option. What we also find here is sometimes the tooth can be broken in the back side, and then cavity can penetrate, or decay can penetrate inside because now there's no enamel cover. And so the dentin is exposed and creates a lot more decay process. And then this one shows how extreme that cavity can get. This entire dark area here is all decay. And if you look down into the root aspect, you can see dark areas around in here, which is the start of an infection. People will get an abscess, get swelling, pus will start coming out of their gums, and that's what a toothache is. So the goal of early treatment is to prevent a situation like this.
Excellent. Well, thanks so much for coming in, bringing those visual aids. Hopefully with a little more knowledge, people will be not so ignorant when they go to the dentist. Thanks so much for sharing all that information with us. Well, coming up next, meteorologist Joe Hansel will have another check of your weather forecast.